The term glycemia indicates the concentration of glucose in the blood, main source of energy for our organism, in particular for the brain and the nervous system. Glucose represents the vital fuel that feeds every cell in our body, and under normal conditions the value of fasting blood sugar, that is after at least 8 hours without eating, ranges between 70 and 100 milligrams per deciliter of blood. However, when fasting blood glucose levels exceed 100 milligrams per deciliter of blood, we speak of hyperglycemia, and in particular of prediabetes, if the fasting blood sugar is between 100 and 125, and diabetes, if it is greater than or equal to 126 milligrams per deciliter of blood. The Italian National Institute of Health recalls that if blood sugar is very high or remains high for long periods of time, serious cardiovascular, neurological, renal, and ocular complications may appear, up to the death of the subject. But how can you lower your blood sugar naturally? Let's go and see what the experts' indications are, and in particular 5 fundamental points that you absolutely must respect. Lose weight. The body mass index is a biometric data obtained from the ratio between body weight and the square of an individual's height. It is a fundamental parameter which, in addition to establishing whether one's weight is within the norm, is an important indicator of the risk of disease and mortality. The higher the body mass index than the ideal values, the higher the amount of fat in the body. The visceral one in particular tends to accumulate around your organs, such as the liver and pancreas, and can cause what is called insulin resistance. It is a condition in which the body's cells begin to respond less to the action of insulin, a protein hormone produced by the pancreas to regulate blood sugar, as it allows glucose to be absorbed into the cells. In the case of insulin resistance, the pancreas tries to compensate for this lower efficacy by increasing the amount of insulin produced until the cells completely stop responding to this hormone, or the pancreas no longer functions properly. This will increase blood sugar levels and lead to diabetes, especially type 2. To reduce blood sugar, you must therefore start from controlling your body weight. Losing weight, or rather reducing your body fat percentage, in order to achieve a good body mass index helps improve insulin sensitivity, consequently reducing blood glucose levels and halting the progression towards diabetes. However, remember that the body mass index must be considered together with other parameters, such as the abdominal circumference, which allows to evaluate the amount of visceral fat, and body composition, which provides a precise indication of the percentage of lean mass and fat mass inside an individual's body. Therefore, maintaining a normal body weight and a fat mass within normal values also allows to reduce the risk of the onset of metabolic, cardiovascular, respiratory, hepatic diseases, and other complications related to overweight or obesity. Do physical activity. The physical exercise is considered as a real medicine and should be an integral part of a healthy lifestyle at all ages. Regular physical activity increases the body's sensitivity to insulin, which means that cells are better able to use this hormone to absorb glucose during and after exercise. Why does this happen? We know that at rest, muscle tissue uses insulin to get glucose into cells so that it can then be burned to obtain the necessary energy. The mechanism of action is simplified by imagining insulin as a real key that, entering the lock, that is its receptor located on the cell membrane, can open or close the door, which allows sugar to enter the cells. When, on the other hand, we do intense physical activity, that same muscle tissue is able to absorb glucose from the blood, even in the absence of insulin. This is because the so-called glucose transporters are moved from within the muscle cells to the plasma membrane of the latter, resulting in a reduction in blood sugar. Therefore, doing regular physical activity reduces both the amount of insulin and glucose in the blood, as it progressively improves the ability of the liver and muscles to respond to the action of insulin. Physical exercise, therefore, represents a key element in the prevention and treatment of insulin resistance and diabetes mellitus. Not only that, by increasing energy expenditure, it helps control body weight and helps reduce the body mass index. Diet. Nutrition plays an essential role in managing blood sugar levels, so it is necessary to pay attention to our diet. We know that there is a parameter known as the glycemic index, which measures the speed with which a certain food increases the concentration of glucose in the blood. The glycemic index, indicated with a score ranging from 0 to 100, allows to classify foods into three main groups. Below 55, we find foods with a low glycemic index, such as whole grains, including spelt, oats and barley, legumes, dairy products, most vegetables, except potatoes and cooked carrots, and fresh fruit, except ripe banana and watermelon. Between 55 and 70, there are medium glycemic index foods, including basmati rice, pasta, couscous, pineapple, and many more. Over 70 instead, we find foods with a high glycemic index, such as rice and white bread, packaged snacks, French fries, cakes and biscuits, and sliced bread. In the description of this video, I leave you the link that refers to the glycemic index table of all foods. Based on what has just been said, to reduce blood sugar, we could think of eliminating all those foods with a high glycemic index from our diet. But does it really work that way? According to experts, the answer is no, in particular for two reasons. The first is that the glycemic index of a food is highly variable, as there are several factors that can alter its score. Some of these are the amount of fiber, the type of processing it has undergone, the cooking method and duration, but also the combination with other foods that are consumed in that meal. In the case of fruit and vegetables, however, the glycemic index also depends on the variety, their degree of ripeness, and their cultivation area. The second reason instead, as recalled by the Italian National Institute of Health, is that the glycemic index only tells us how quickly blood glucose levels rise, but it doesn't tell us by how much it increases. We must therefore consider another parameter, perhaps even more important than the glycemic index because it takes into account the portion consumed, that is, the glycemic load. It is a numerical value that establishes the impact of a carbohydrate meal on blood sugar with greater precision and is calculated by multiplying the glycemic index of a food by the amount of carbohydrates contained within it, all divided by 100. This is a very important factor to take into consideration, otherwise you run the risk of choosing a food with a lower glycemic index, but perhaps with a high glucidic density. From this, we understand that even low/medium glycemic index foods can cause hyperglycemia, only that with the same carbohydrate content, they can be consumed in proportionately higher quantities than high glycemic index foods before a high glycemic load is obtained. We have just seen that it is not the high glycemic index itself, and therefore the rapid absorption of carbohydrates, that causes hyperglycemia, but the glycemic load, that is, the relative quantity of carbohydrates taken following the consumption of that food. In summary, to obtain the maximum benefits in reducing blood sugar, the glycemic load of meals should be lowered as much as possible, certainly favoring foods with a low glycemic index. It is therefore important to take the right amount of dietary fiber every day, which we find above all in fruit, especially apples, pears, raspberries, and avocados, in vegetables, including artichokes, cabbage and aubergines, legumes, and whole grains. According to some studies, even adding extra virgin olive oil to food helps to lower the glycemic index of the meal, as it slows down digestion and the absorption of sugars and avoids the so-called glycemic surge. The same happens if we add protein-rich foods to the meal, such as chicken breast, as they slow down gastric emptying and keep blood sugar under control. However, another fact emerges to which attention must be paid, namely that proteins and fats increase insulin secretion, especially if taken together with carbohydrates. For this reason, when we want to reduce blood sugar, we must also take into consideration two other parameters recently introduced, which are the insulin index and the insulin load. These are two important values that measure respectively the production and the impact of a food on blood insulin levels. In conclusion, to control hyperglycemia, it is necessary to take into consideration all the parameters we have just talked about, avoiding homemade diets. The advice, therefore, is to always consult a specialist before starting any diet in order to receive a personalized plan suitable for your needs and the results you want to achieve. Reduce stress. Stress is part of the daily life of the vast majority of the population and is defined as a psychophysical reaction that the body experiences when it is faced with tasks or life events that it considers excessive or dangerous for the individual's health. Stress can be positive when it gives us the right energy to face a sports competition, an exam, or a new job, but also negative when it overwhelms you or continues for a long time. Stress has a direct and negative effect on blood sugar levels, as by activating the sympathetic nervous system and the hypothalamic pituitary adrenal axis, it causes a release of stress hormones such as cortisol, adrenaline, and noradrenaline. The body is thus in a constant state of alert, whereby it keeps blood sugar levels high so that it always has a sufficient amount of glucose and therefore energy available. Not only that, high cortisol levels due to chronic stress seriously alter insulin secretion, favoring insulin resistance and therefore the development of metabolic diseases. Easy to say, but difficult to do. To lower blood sugar, you should try to reduce stress or otherwise try to deal with it and manage it effectively. From relaxation techniques to exercise, from proper sleep hygiene to psychotherapy, there are several options we have available to try to lower cortisol levels in the body. Dehydration. When you are not sufficiently hydrated, the amount of water in your bloodstream decreases, and therefore your blood glucose becomes more concentrated. Although the amount of sugar in the bloodstream is not actually increased, the ratio of sugars to water is altered, making glucose levels appear to be higher. A state of dehydration increases the production of vasopressin, also known as antidiuretic hormone. It is synthesized in the neurons of the supraoptic and paraventricular nuclei of the hypothalamus, transported to the nerve endings located in the posterior lobe of the pituitary, where it will accumulate until it is released into the blood vessels. Increased production of this hormone signals the kidneys to retain as much water as possible and can cause the liver to produce more glucose, affecting the body's ability to regulate insulin over time. From this, it could be deduced that drinking more water decreases blood sugar, but according to some studies, this does not happen. In a study of 24 Japanese men and 31 women with normal fasting blood sugar levels, each participant drank a 550 milliliters bottle of water within 2 hours of waking up, and another 550 milliliters bottle 2 hours before bedtime. The results showed that there were no significant changes in fasting blood sugar, while blood pressure was significantly reduced and helped protect kidney function. There is therefore little evidence of the positive effects of water in improving glycemic parameters in diabetic and non-diabetic people, and the results are heterogeneous, making it difficult to reach a clear conclusion. In summary, drinking a sufficient amount of water daily does not seem to lower blood sugar, but it does prevent it from rising if the body is dehydrated.